Hello everyone, welcome to the YouTube channel of Chameli Devi Institute of Pharmacy, Indore. In previous video, prescription part 1, I have discussed prescription and parts of prescription. So, in this video, I am going to discuss about handling of prescription. So, let's start. So in today's session we will discuss about some key point of prescription, that is handling of the prescription. What are the different steps used in handling of the prescription, and then what are the sources of error in writing of prescription. So in this slide we will discuss different steps of handling of the prescription. So the following steps should be adopted by the pharmacist while handling the prescription for compounding and dispensing. So the first step is receiving. So receiving, that means receive the prescription from the patient directly. The next step is reading and checking prescription properly, collecting and weighing the material, and the last is compounding, labeling and packaging of dosage form. So the first step of the handling of prescription is receiving the prescription. So the prescription should be received by the pharmacist himself from the patient directly. While receiving the prescription, pharmacist must keep some fact on mind, that is, pharmacist should not change any facial expression, because the facial expression may cause an impression on the patient that he is surprised or confused after seeing the prescription. So it is the very important point that pharmacist should not change any facial expression after seeing the prescription, because patient may feel that pharmacist is surprised or confused after seeing the prescription. Okay, so now second step in the handling of prescription is reading and checking of the prescription. So on receiving the prescription, the pharmacist should check the prescription whether it is written in proper format. So the first step in this reading and checking, so on the receiving a prescription, pharmacist always check it that it is written in a proper format. In a proper format means a prescription should be written on the doctor's notepad or OPD slip of the hospital or nursing home and signed by the prescriber along with date, and the prescription always screened behind the counter by the pharmacist. In case of any difficulty in reading or any doubt regarding the prescription, ingredients or drug or direction, so pharmacist should discuss with another senior pharmacist or physician directly, but not with the patient. So this is the important point of this step. So in this point, pharmacist may have any confusion or any doubt regarding the prescription or direction or drug, so pharmacist should consult directly to the physician or senior pharmacist, but under no circumstances patient should come to know about it. Pharmacist should never guess about the meaning of any illegal or any confused word, because it may lead to serious consequences. Nowadays, sometimes prescription is received on a telephone by senior pharmacist. So in such case, after taking down the prescription, it should be verified by repeating it on the phone to the prescriber. It is important because nowadays the number of drug with almost the same pronunciation and spelling with available in the market. For example, acridine or epidine, digitoxin or and digoxin. Apart from that, if there is any omission of any important particulars such as dose or direction to the patient, so the pharmacist directly consult with the prescriber. The next step in the handling of prescription is collecting and weighing the material. So this is a very crucial step. So pharmacist must be careful to do that. So before compounding the prescription, all the material required for it are collected on the left side of the balance, and after weighing, each material should be shifted on the right side of the balance. So before weighing, all the material are collected on left side of the balance, and after weighing, the material should shifted on the right side of the balance. So this gives a recheck of an ingredient which have been weighed. While compounding, the label of every stock bottle should be read at least 3 times in order to avoid many error. So pharmacist should read the stock bottle label for 3 times to avoid any error which can be when taken from the shelf. So when pharmacist withdraw the stock bottle from the shelf or drawer, so pharmacist should read the name of the ingredient. Pharmacist should also read ingredient or stock bottle name when the contents are removed from the for weighing or measuring. At the time of weighing, pharmacist should also read the name of stock bottle or content at the time of weighing. And the third time is when pharmacist return the container back to its proper place. So at least 3 times reading occur when pharmacist remove the ingredient bottle or stock bottle from the shelf, and when the contents are removed for weighing or measuring, and when the containers are returned back to its proper place. So the last step in the handling of prescription is compounding, labeling and packaging. So after the weighing of ingredients, compounding is carried out. So compounding is done on neat place. Before the compounding, all the equipments which are required in compounding are cleaned and dried thoroughly. And when compounding is done, so only one prescription should be compounded at a time to avoid the confusion. All the ingredients should be compounded at a one time, and all the ingredients should be compounded according to the direction of the prescriber or according to the pharmaceutical art. After the preparation, the compounded medicament should be filled in a suitable container depending on its quantity and use. So container selection for the compounding is depending on the quantity and use of the material, and the filled container are suitably labeled. So the size of label should be proportional to the size of container. So label should not be not too smaller and not too larger. For labeling, white plain paper of good quality should be used, and the size of the label should be proportional to the container which is written or typed, given all the desired information, and the label should be fixed with a good quality of adhesive and placed almost in the center, leaving equal space from the bottom and top of the container. After the filling and labeling, the container is polished so as to remove the fingerprint on it. And at the end, while delivering the prescription to the patient, the pharmacist should explain the mode of administration, direction for use, and storage conditions. So, performing all these steps, pharmacists should have to be very careful regarding this, because any mistake or confusion can lead serious consequences, or it can be life threatening. After the handling of prescription, now we will discuss source of error in prescription. So what are the different kind of sources of error in prescription? So first is abbreviation. So abbreviation is the short term or short form of Latin or English term which is used for the short form of drug or dosage form or an ingredient, and the misinterpretation of these abbreviation may cause error in prescription. So abbreviation present a problem in understand part of the prescription order. So extreme care should be taken by a pharmacist in interpreting the abbreviation. Pharmacists should not guess at the meaning of an ambiguous or confusing abbreviation. For example, to dispense acromycin for acro may cause difficulty when the intention of prescriber is to dispense acrostatin. So acromycin is an antibiotic and acrostatin is used for high lipid condition. So it may cause the big error in the prescription. The next source of error in prescription is name of the drug. So there are certain drugs whose name look or sound like those of other drug. So some of the example of such type of drug are digitoxin and digoxin. So in digitoxin and digoxin, the abbreviation of these drugs can be DIG dot. So it may also cause the error in the prescription. And another example is prednisone and prednisolone. When prescription is received on telephone, so this type of name of drug may cause errors in prescription. Now the third source of error in prescription is strength of preparation or strength of formulation. So the strength of preparation should be stated by the prescriber. It is essential when various strengths of products are available in the market. For example, it will be a wrong decision on the part of a pharmacist to dispense paracetamol tablet, which is usually prescribed in 500 mg, when prescription for paracetamol tablet is received with no specific strength. So in this condition, pharmacists should not assume or make any guessing about the dose or strength of drug. So this error can be avoided by direct contact or direct consult with the prescriber about the strength of dose, strength or preparation of drug. And the next source of error is dosage form of the drug prescribed. So many medicines are available in more than one dosage form, such as liquid dosage form, tablet, capsule and suppositories. So the pharmaceutical form of the product should be written on the prescription in order to avoid confusion. So pharmacists first of all have to confirm the dosage form of the formulation with the doctor or prescriber. So to avoid this type of error, pharmacist should ask to the prescriber directly for dosage form of the drug. So the next error of prescription is dose. So dose is the certain amount of drug to be prescribed by the prescriber. So unusually high or low dose should be discussed with the prescriber. Sometimes pediatric doses may be a problematic, so pharmacist should consult pediatric posology to avoid any error. So pediatric posology means for the pediatric dose there are certain formulas available for the dose calculation. So for pediatric formulation, dose can be calculated on by those formulas. So dose can be vary from adult dose. Sometimes a reasonable dose is administered too frequently for maintaining a constant therapeutic level. So for example, a prescription for sustained release formulation to be administered after every 4 hours should be thoroughly checked because such dosage form are usually administered only 2 or 3 times in a day. So pharmacist should have to check these type of doses which are used in some special condition or some pediatric patient. So the next source of error in prescription, which is instruction for the patient. So the instruction for the patient which are given in the prescription are incomplete or omitted, so error can be occurred. Instruction for the patient regarding dose administration, route of administration and time of administration should be clear by the pharmacist. So the pharmacist should be explained to the patient regarding quantity of drug to be taken and the frequency and the timing of drug or administration of drug and route of administration should be clearly given in the prescription so as to avoid any confusion. For example, some tablet like proton pump inhibitor can be taken in should be taken in empty stomach so that they can release the drug into the intestine pH for better absorption of drug, but pharmacist or prescriber are omitted to given these direction to the patient or explain these direction to the patient, so the absorption of drug not properly taken place. Another example is antihistaminic drug which is given at the bedtime to avoid the accidental condition or situation which may be occur due to its side effect such as drowsiness or sedation and hypnotism. So this is a very important step, and by the given proper direction to the patient, these error can be avoided. And the last sources of error is incompatibilities. So incompatibilities is a phenomena when we mix two or more drugs and they form undesirable product which may affect the safety, efficacy and appearance of the pharmaceutical preparation. So incompatibilities is essential to check that there are no pharmaceutical or therapeutic incompatibilities in a prescribed preparations, and that different medicine prescribed for the same patient do not interact with each other to produce any harm to the patient. Certain antibiotics should not be given with meals since it significantly decreases the absorption of drug. So the example of this condition is tetracycline with milk. So tetracycline is an antibiotic which form a chelate with the milk, calcium of milk and form a gel-like consistency, so which leads poor absorption of tetracycline. So these are the different sources of errors in prescription which can avoided by the taking care by the pharmacist and prescriber as well. So these error can be avoided by following precautions. First is always keep the prescription before you, and at one time only one prescription is handled. Always check the balance before buying the ingredient. Must read the name of stock bottle 3 times. When pouring or measuring the liquid ingredient, keep the label upward in the order to prevent liquid running down. Balance and area of dispensing should be clean, and the direction on the label must be given very carefully. And for any confusion or any doubt, pharmacist should have to consult with doctor or prescriber of the prescription. Thank you.